Hello, my name is Dr. Willie Harper, and thank you for joining us today for our bariatric surgery seminar. A little bit about myself. I am a board certified general surgeon. I've been practicing here in the area for the last 10 years. What I'm most proud of in those 10 years is I've helped to develop an outstanding bariatric surgery program here at St. Bernard's Medical Center. Today, we're going to be talking about our bariatric surgery program and really what it means to have weight loss surgery here at St. Bernard's Medical Center. We'll first talk about our mission. Our mission here at St. Bernard's is to help you discover a healthier you. And I chose that title or that mission for our bariatric surgery program because it's a little bit more than just weight loss that we're after. We actually want you to have an entirely healthier lifestyle. We want you to be able to do the things you could not do because of the disease of morbid obesity. Why choose St. Bernard's Medical Center for your bariatric surgery experience? Well, there are a number of reasons. The first reason is our highly qualified surgeon and staff. We pride ourselves on giving you a comprehensive care approach when it comes to bariatric surgery. We have a multidisciplinary team which consists of dietitians, psychologists, therapists, surgeons, great nursing, all of which come together to give you the best experience possible when it comes to having bariatric surgery. Not only that, we pride ourselves in implementing the latest in technology when it comes to your bariatric surgery experience. I specialize in robotic techniques. Many of you may be familiar with the Da Vinci robotic system that's revolutionized the surgical industry. We do employ that on all of our bariatric surgery procedures. Also, we specialize in the care of patients with high body mass indexes, or otherwise known as obese patients. Our staff has a passion to help you reach your weight loss goals, and that's one of the things that we pride ourselves on. We are on the path of becoming an accredited bariatric surgery center by the MBSQIP. That's the Metabolic and Bariatric Surgery Quality Initiative Program. We give great quality bariatric surgery care, and we would like to be recognized as such. Once you have your surgery with us, that's not the end of the story. We do offer also monthly in-person support groups and as well as online Facebook support groups. I found that having a discussion with others who are undergoing or have the potential to undergo bariatric surgery ultimately improves the experience for everyone involved. You will have regular post-operative appointments with me for both medical and nutritional guidance, and we think that this is imperative to your overall success on your weight loss journey. So who qualifies for bariatric surgery? In general, it's patients with a body mass index of 35 or greater with obesity-related complications, including diabetes, high blood pressure, as well as obstructive sleep apnea. Also, patients with a body mass index above 40, even without those comorbidities. These services are offered to patients above the age of 18. There are some things that patients have to do before they undergo weight loss surgery here. These include a psychological evaluation, a nutritional evaluation. You need various imaging tests, which includes an upper GI and abdominal ultrasound, as well as various blood work testing. You also will need to consult with our anesthesiologist, and we will also obtain an EKG. These evaluations help us to better understand your particular medical issues prior to proceeding with weight loss surgery. There are possible additional preoperative evaluations other than the ones I've stated, and these will be established on a case-by-case basis. The structure of our program includes 3 preoperative appointments. Our first appointment is for you and I to get to know each other a little better. It's for me to really understand your medical history, and then it's for me to introduce all the eligible procedures when it comes to weight loss surgery. Our second visit will include a review of all the testing that you have undergone. Any questions up to this point will be answered about the proposed operative procedures. We will talk about the risks and benefits of surgery. And at this point, we will decide definitively on which operation you choose to proceed with. Your preoperative evaluation file will then be sent to your insurance company for a review, and once approved, we will schedule your surgery. The third appointment with me will be geared towards understanding what your experience will be like on the day of surgery and the days that follow. This appointment will be for a final history and physical review. We will also explain at that time any necessary preoperative diet that you may need to undergo. Speaking of the preoperative diet, most patients will be assigned either a 1 or 2 week liquid diet prior to their surgery. Again, we will discuss this at your third appointment with our dietitian, and we also will assign you a start date for this particular diet. At this point, we will answer any dietary questions related to your preoperative diet. The purpose of this diet is to jumpstart your weight loss to make surgery easier and safer. This has great effects on our ability to carry out our operation with minimal complications. So what procedures will we discuss? We will talk about 3 separate procedures, our first being a Roux-en-Y gastric bypass. Next, we will discuss a sleeve gastrectomy. And then we will discuss one of our newer operations, what we call a single anastomosis duodenal-intestinal bypass. This is otherwise known as a SADY procedure. The first operation we will discuss is called a Roux-en-Y gastric bypass. This is considered the gold standard operation when it comes to weight loss surgery. It's the procedure that all other procedures are compared to in terms of what to expect in weight loss, as well as what to expect years down the line in terms of whether or not you regain weight or any potential complications you may have following surgery. In this operation, what we do is we make a small pouch out of the upper part of your existing stomach. Once this pouch is made, we then reroute your small intestines to connect to the pouch. This does 2 things. It allows you to eat less food and still feel what we call satiated or full. It also bypasses a significant portion of your stomach and small intestine. This is what we call the malabsorptive component of the operation. Both the restriction with the small pouch and the malabsorption part of the operation make this to be a very powerful weight loss option. The next operation we'll talk about is called a sleeve gastrectomy. This is a newer operation in comparison to that of a gastric bypass. With this operation, what we do is we remove a significant portion of the stomach, in some instances up to 85 to 90% of the stomach. What you're left with is a tubularized, smaller stomach. You can imagine in this smaller version of your stomach, it allows you to eat less and feel full. There are a couple reasons for this. The volume that this new stomach holds is much less than your original stomach. There are also some hormonal influences that take place by removing the large part, what we call the greater curvature of your stomach. This part of your stomach holds cells that secrete hormones that tell your brain whether or not you're full or whether or not you're hungry. By eliminating the hormone that tells you that you're still hungry, this will allow you to feel fuller even with very small amounts of food. The result of this is significant weight loss, which is why this has become a popular option when it comes to weight loss surgery. A third procedure we will talk about is called a SADY procedure, or a single anastomosis duodenal-intestinal bypass. With this operation, it's a combination between that of a sleeve gastrectomy and a gastric bypass. We do perform a sleeve as part of this operation, but in addition, we bypass a significant portion of your small intestine. This combination has been shown to provide an even greater weight loss than that of a gastric bypass. Also, studies have shown that this operation provides a more sustained weight loss than either a gastric bypass or sleeve. This makes it a very powerful option when it comes to bariatric surgery. Okay, now that we've talked about our various procedures, there are some important things to note no matter which bariatric surgery operation you choose. Our first and foremost rule is that you must quit or cease all nicotine usage. This includes smoking, this includes vaping, this includes nicotine patches. Any substance that contains nicotine must be avoided, no matter which operative procedure you choose. After surgery, you also will not be able to take what we call non-steroidal anti-inflammatory medicines. Examples of these medicines include Toradol, ibuprofen, Goody's headache powders, Mobic, diclofenac. These medicines are damaging to the stomach, especially in patients who have had weight loss surgery. We also ask that you avoid carbonated beverages after surgery, and we also ask that you avoid sugar-sweetened beverages because these increase the incidence of what we call dumping syndrome. Also, vitamin and mineral supplementation will be needed for the remainder of your life following one of these operations. Okay, so what happens after surgery? Bariatric surgery is a lifelong commitment. Your postoperative appointments after having weight loss surgery will be at the 2-week mark, the 3-month mark, the 6, 9, and 12-month marks. After you reach this level, we will see you annually thereafter to make sure things are still going appropriately. Lab work will be necessary prior to each visit to assess your nutritional status. And this cannot be overemphasized. Exercise is a key component to the success after having bariatric surgery. So, more about exercise. There are guidelines that one should exercise at least 30 to 45 minutes each day, 5 days per week. Surgery is just a weight loss tool, but it requires making sustainable habit changes in order to be successful ultimately. Another word about our support group. Research states that our support groups that are in place will lead to higher success rates after having weight loss surgery. Just to note, our support group meets on the first Tuesday of each month in the Health and Wellness building. There's also a Facebook support group page that you can join once you are in the program. Thank you for joining us today. If you have any further questions, please contact our bariatric program coordinator. Her number is 870-243-0531. Again, thank you.